Cervical disc herniation. This is a disc herniation in the neck. How does it happen? Well, it happens just from everyday normal wear and tear in life. We see it probably 50% of people don't really have an identifiable cause or something that happened. They just tear. It's one of the weak links of the human body. Fortunately, most herniations go away on their own and don't have to have surgery. At least the symptoms go away on their own. The chance of a herniation disappearing completely is around 15%. About 50% of the time, the herniation can get smaller with time because every time your heart beats, the spinal fluid pulsates up against it like water against a rock. It can make it smaller. So most of the time, people don't need surgery because the symptoms settle down. But what the herniation can cause that may require surgery is severe pain, numbness, and weakness. It can also affect your spinal cord, which can cause clumsiness of your hands or throw your balance off. So that's where the history and the physical exam really comes to be important as to how significantly is this affecting you. If it's really bad, where it's significant loss of function and weakness, we may do surgery right away. Typically, if it's more pain without a real deficit, we'll give this a couple months to see is it going to get better on its own. Now, if somebody's in agony and it's a large herniation, we may operate sooner than that. How do we treat them at first? Typically, we start with get rid of the inflammation. We try oral medications, anti-inflammatories, muscle relaxants, pain relievers, nerve medications. We may do an epidural injection, which is a cortisone shot in the neck. The goal of all of that is just to cool things off and buy us time to see is this going to go away on its own. From a physical therapy perspective, we do postural strengthening exercises in order to get the muscles stronger, to take some stress off the disc, to decrease some of the pain, to hope this goes away on its own. Chiropractor, acupuncture, decompressive machine, laser. There's a lot of other treatments that can help some of the pain to hope this herniation goes away on its own. There is some risk for a real violent manipulation. If you have a disc herniation and you get a violent manipulation, it may make the herniation bigger. So you want to go slow and be calm and don't push it too hard. So the goal is to decrease the pain and inflammation, build up your muscle strength to take the stress off the disc and avoid surgery. Please check out our video on the cervical rehabilitation for all those exercises. As far as surgery goes, if you're not getting better, there's 3 basic surgeries that we do. 2 of them are from the front, 1 is from the back. The 2 from the front are a fusion and an artificial disc replacement. They're both very similar surgeries that have great outcomes. The only difference is with the fusion, you stop the motion with a plate, and so it prevents the problem from ever coming back at that level, and it really gives the nerve the best chance to recover. Whereas the artificial disc replacement preserves motion, which can put less stress on the other levels. They're both good options, and we do both. Just depends on what's best for each individual person's problem. The 3rd surgery is a posterior cervical foraminotomy with the microscope, where we go in and remove some of the facet joint and open up the hole for the nerve. And that's a great surgery too for the right person. The downside of that surgery is it doesn't necessarily get all the disc and bone spurs out from the front, and the problem may recur and people may need to have a revision surgery. So all 3 are great options. Your choices at this point are 2 of them. One is you can email us directly at info@watkinsspine.com to see if we can help. The second option is to watch the video that corresponds with your problem. You can watch the cervical artificial disc replacement, fusion, or microscopic foraminotomy. Thank you.